So today we're going to talk about measuring cervical extension using a goniometer, and this motion occurs in the sagittal plane and is mainly the combined movement of the OA joint and the facet joints of the cervical vertebrae. At the OA joint, you have the convex occipital condyles rolling posteriorly and gliding anteriorly on the atlas. And then you have the motion of the facet joints that add to the cervical extension. And with this motion, you have the inferior facet of the higher vertebrae gliding posteriorly and inferiorly on the superior facet of the lower vertebrae. The main muscle groups that you use to perform cervical extension are the upper trapezius, the splenius capitis and cervicis, the semispinalis capitis and cervicis, and the erector spinae capitis and cervicis. And then the extension is limited by the bony contact of the cervical spinous processes and by passive tension created anterior to the axis of rotation. And so some of the structures that could get taught in cervical extension would be the anterior joint capsule, the annulus fibrosus, the longitudinal ligament, and then anterior neck and trunk muscles. Neck extension range of motion should be measured if a patient comes in and is complaining of neck pain, shoulder pain, or upper back pain, because you want to measure the joint above and below where their injury is occurring. If a patient has unstable cervical spine fractures, you should not measure their cervical extension, because you don't want to put them in that position. We do measure active range of motion with cervical extension, and we do not measure passive range of motion, because it is the active range of motion that is affected by pain, fear of movement, and fear of injury. And then active range of motion is also closer to the type of movement that a patient will be using in a functional activity, and so that is more relevant to their impairment. Intra-tester reliability is better than inter-tester reliability, as it is 0.86 compared to 0.82. However, both of those measures indicate a good reliability. And according to Norkin and White, there have been no validity studies conducted with cervical extension, because there have been no studies that compare goniometry measurements to the gold standard of radiographs.
Okay, so we're measuring active range of motion of cervical extension. You want to have the patient seated in a chair so that it can stabilize their thoracic and lumbar spine, so you don't have excessive extension there. You will also have the patient looking straight ahead so they're at a neutral position. And first you're going to check to make sure that they can get through 0 degrees of flexion. And then when you use the goniometry, the fulcrum, which is the axis right here, will be at their external acoustic meatus, with the stationary arm being perpendicular to the floor, and then the movable arm will be in the same plane as their nose, or a tongue depressor, which would be in between their teeth for a marker. So for good body mechanics, you're going to want to make sure that you're at eye level with the patient, which requires some squatting, or you can use a stool to sit on, because in order to read the goniometry correctly, you have to be very close to it. You also will be palpating for T1 spinous process for when it moves, because that means that your thoracic spine is starting to extend. And lastly, normal range of motion, it would be 55 to 65 degrees.
So now I'm going to go over how to demonstrate using a goniometer measuring cervical extension, being a therapist and acting with a patient. Okay? So, hi, my name is Sarah Ide. I'm going to be your therapist today. But first let me wash my hands, okay?
Okay.
All right. How are you doing?
I'm good, how are you?
I'm good. So today we're going to be measuring your cervical extension. So basically how far you can tilt your head back.
Okay.
And we just want to do this to make sure that you can go through the normal range of motion. All right, so we're going to be using this tool. It's called a goniometer. We have this arm here that's stationary, so it's just going to kind of go up against your head and stay put while this arm will move with your motions.
Okay.
But before I do that, I want to make sure you're sitting nice and tall in the chair. Okay, so I want to make sure that you can go through both flexion and extension. So can you look down at the floor? Good. And can you look up towards the ceiling? Good. All right, so go ahead and look straight ahead, nice and tall. I'm going to be putting this close to your head again. So I'm putting the axis right beside your ear. This stationary arm is perpendicular to the floor, and this movable arm is right at the inferior border of your nose. And good, you are at 0. Okay. So now I'm going to feel on the back of your spine, just your vertebrae, and what's going to happen is when you're tilting back, when cervical extension stops, the vertebrae right below it, which is your first thoracic vertebrae, is going to move. Okay, and that marks the end of extension. So I'm just going to feel for those processes here. Go ahead and look down. Okay, and you can come back up to neutral. And I'll make sure you're back at 0 again. Okay, now go ahead and tilt your head back, and I'll tell you when to stop. Okay, just hold it right there. And you are at 56 degrees of cervical extension range of motion, which is normal. Normal is 55 to 65. So good job.